All right, let's leave that in the moment and at the moment and talk about yet another issue where it seems the COVID-19 pandemic might just become some sort of business venture for some Nigerians. The federal government has accused some airport workers of taking bribes from travelers, allowing them to evade the mandatory quarantine at the airports in the country. And the chairman of the Presidential Steering Committee on COVID-19, Boss Mustafa, says the authorities are conducting all the investigations now to prevent a spike in infections in the country. Desperate times, and we are seeing people also capitalizing on a pandemic as the COVID-19 to make some money for themselves, albeit unpalatable as this.
It's, trust Nigerians the way we do our things. One, I blame government. The cost of the PCR test is on the high side. I mean, at 51,000 naira. So people want to evade it. I mean, it ought to be subsidized. And for those who are traveling, the government want to tell you, yes, you must be rich before you say you want to travel. I mean, you can't just say you want to travel. Now, people are hiding under that to try and beat the system. Nobody wants to pay, because before you travel, whether you are inbound or outbound, you must make provision for 2 tests, which is about 100,000 naira if you are in Lagos, Abuja, Port Harcourt, or Kano. But other parts of the country, I think it's 39,000 times 2. So I don't know what informed that decision, as if it's not the same reagent that will be used in Lagos, that will be used that they are using in other states where you have a differential in price. But at times they will tell you because of the volume and what have you. But even if we are talking about volume, it should be it should be cheaper. So now people want to evade that. So the 7-day test that they normally book for when you are coming into the country, when you are inbound, those airport officials now have a way of telling whoever cares to listen that if you are coming in, you don't need to pay. Just come in, give us 10,000 or 20,000 and we'll allow you to go. So which means especially those from countries on the red list like India, Brazil, South Africa and Turkey. I mean, those where the Delta variants are very prevalent. So that's why it is very, very difficult. And you see, we deceive ourselves quite a lot. Most of the testing we are doing now are those who pay to, the result of the test we see, are those who actually pay for the results. Because the moment you pay for the result, your result is uploaded into the NCDC database. So it's not as if the government is doing voluntary tests again. It's only when it becomes very expedient that somebody is critically ill that they will not, because nobody, me as Mojib Dami, will not say, now I'm feeling ill, I will now go, I want to go and do a test and pay 50,000. No, most people don't want to do that, except it's expedient on you to travel and you need to pay that amount of money, and people are bypassing the system. And also, there was a time about 2 weeks ago that the system actually crashed. Even if you pay abroad, it's supposed to generate a paid receipt for you. But even if you pay, if you make a payment, you won't be able to see that receipt, the receipt. So people were now looking at ways to, to bypass the system. So the NCAA had to issue a statement then that airlines should allow passengers to come and make payments when they get into the country. So that opened up a lapse in the monitoring system. So people are
that will also be capitalized again. Yeah, used for other wholesome gains.
If those who didn't make any attempt to pay at all will say, I tried the portal is down. So even when the portal now came back, because I think the glitch was just for about 3 or 4 days. When the portal now came back, people are not using it again.
Imagine so the backlogs.
Yeah, they were just coming in and making payments. Even those who are traveling outside the country, they have a way of generating fake PCR tests that will give them a negative result. They present it at the airports and they will go. Even when they are accosted at the airport and the airport officials find out that this it's a fake result, they'll just call you aside and tell you, bros, this thing is fake, but if you still want to go, you know your flight, you miss your flight, drop 20K and you go. They'll take the 20K and they will allow the passenger to go.
We are even seeing people also, you know, manipulating the COVID-19 vaccine cards. And now the government is also saying it will move on to wield the big stick on these elements within its workforce that are also issuing fake vaccine cards. What do you make of all these sharp practices, BKO?
You know, our capacity to respond appropriately when tipped off about these unwholesome practices is what I'm not impressed about. This thing is not new. This thing that this particular acts of corruption that the federal government is complaining about is not new. It's almost as old as COVID-19 in Nigeria.
As the pandemic.
Our
people have been doing this for some time. There was an alarm that was raised that the Minister of Health talked about, where he said that people were procuring fake PCR test results at point of entry in our country, mainly the Nnamdi Azikiwe airport in Abuja and Lagos. What we had was, we are going to investigate. What is the product? What is the end product of the investigation? We don't know. We do not see people punished. Governor Sanwo-Olu cried out loud the other day that people were coming into the country in order not to be quarantined. They give false phone numbers, false addresses, and all that, and they go and mesh into the crowd in our country, infecting our people in the process. Some of them from these countries that are already deemed the red flag countries, like South Africa, Turkey, Brazil, and India. People find a way to come in here and evade all the safety protocols that have been put in place. It's in our country that people get away with things like that. I don't know why we are this loose. Let anyone try it. Let anyone go to Rwanda or even Uganda. You saw that woman, the health minister, that her video went viral. He said, look, we have a place where we will keep you. He was talking to the foreigners who came into their country and said, but you will pay for your accommodation. Uganda will not pay, because you come to our country for business, but we need to protect our people. She was telling them. That video went viral that at the beginning of the COVID pandemic. In our case, when we see white people, we get starstruck. We will not be able to enforce our law against white people, because in any case, a lot of people are we are itching for the green colored currency. They are waiting to be given dollars.
In Ghana, when you get to Ghana from Nigeria, despite the fact that you have your negative COVID test, you will
do another one.
Another test at the airport.
That's the thing. That's the way it should be.
At the airport.
That's the way it should be.
In Ghana.
If you go to Rwanda, you are not going to choose your own hotel. They have a hotel that you are going to stay, so that they can be able to monitor you. The taxi that will pick you from the airport, those are taxis that have been designated to pick inbound passengers. You are not going to do what pleases you. No, they made up their mind, because at a point when they relaxed the measures, there was a spike in COVID-19 cases in their country.
Yeah.
They then said, okay, this is what we'll do. People that will test routinely, they are the ones who will be bringing people from the airport. And if you are going to their tourist centers, there are some tourist centers that at this time you can't even go. The ones that you can go that are designated, they will monitor you. You will do a test immediately you get into their country. They will put you in the hotel. You can't come out until the result of that test is out. You can't come out. So you are there when the result of the test comes. They will now pick you. There are buses that will be taking you as tourists to places.
And this is all enforced. It's all about enforcement.
No, the problem is we have laws. For every situation, we have laws. So
to respond.
but we do not enforce our laws. We do not enforce our laws.
We've run out of time. We just have to, wrap up on today's edition of Journalist Hangout.